21. The nurse is preparing to take a toddler's blood pressure for the first time. Which of the following actions should the nurse do first? A. Explain that the procedure will help him to get well. B. Show a cartoon character with a blood pressure cuff. C. Explain that the blood pressure checks the heart pump. D. Permit handling the equipment before putting the cuff in place. The correct answer is D. Permit handling the equipment before putting the cuff in place. The best way to gain the toddler's cooperation is to encourage handling the equipment. Detailed explanations are not helpful. 22. The nurse is performing an assessment of the motor function in a client with a head injury. The best technique is A. Firm touch to the trapezius muscle or arm. B. Pinching any body part. C. Sternal rub. D. Gentle pressure on eye orbit. The correct answer is D. Gentle pressure on eye orbit. This is an acceptable stimuli only after progressing from lighter to stimuli to more obnoxious. 23. The nurse is caring for a client with Hodgkin's disease who will be receiving radiation therapy. The nurse recognizes that, as a result of the radiation therapy, the client is most likely to experience A. High fever. B. Nausea. C. Face and neck edema. D. Night sweats. The correct answer is B. Nausea, because the client with Hodgkin's disease is usually healthy when therapy begins. The nausea is especially troubling. 24. A pregnant client who is at 34 weeks gestation is diagnosed with a pulmonary embolism (PE). Which of these mediations would the nurse anticipate the healthcare provider ordering? A. Oral Coumadin therapy. B. Heparin 5000 units subcutaneously. B. I.D. C. Heparin infusion to maintain the PTT at 1.5–2.5 times the control value. D. Heparin by subcutaneous injection to maintain the PTT at 1.5 times the control value. The correct answer is D. Heparin by subcutaneous injection to maintain the PTT at 1.5 times the control value. Several studies have been conducted in pregnant women where oral anticoagulation agents are contraindicated. Warfarin, Coumadin, is known to cross the placenta and is therefore reported to be teratogenic. 25. A newborn weighed 7 pounds 2 ounces at birth. The nurse assesses the newborn at home 2 days later and finds the weight to be 6 pounds 7 ounces. What should the nurse tell the parents about this weight loss? A. The newborn needs additional assessments. B. The mother should breastfeed more often. C. A change to formula is indicated. D. The loss is within normal limits. The correct answer is D. The loss is within normal limits. A newborn is expected to lose 5–10% of the birth weight in the first few days because of changes in elimination and feeding. 26. A client is receiving total parenteral nutrition (TPN) via Hickman catheter. The catheter accidentally becomes dislodged from the site. Which action by the nurse should take priority? A. Check that the catheter tip is intact. B. Apply a pressure dressing to the site. C. Monitor respiratory status. D. Assess for mental status changes. The correct answer is B. Apply a pressure dressing to the site. The client is at risk of bleeding or the development of an air embolus if the catheter exit site is not covered immediately. 27. A client with a panic disorder has a new prescription for Xanax, alprazolam. In teaching the client about the drug's actions and side effects, which of the following should the nurse emphasize? A. Short-term relief can be expected. B. The medication acts as a stimulant. C. Dosage will be increased as tolerated. D. Initial side effects often continue. The correct answer is A. Short-term relief can be expected. Xanax is a short-acting benzodiazepine useful in controlling panic symptoms quickly. 28. A client is brought to the emergency room following a motor vehicle accident. When assessing the client 1/2 hour after admission, the nurse notes several physical changes. Which changes would require the nurse's immediate attention? A. Increased restlessness. B. Tachycardia. C. Tracheal deviation. D. Tachypnea. The correct answer is C. Tracheal deviation. The deviated trachea is a sign that a mediastinal shift has occurred. This is a medical emergency. 29. A client being discharged from the cardiac step-down unit following a myocardial infarction, MI, is given a prescription for a beta-blocking drug. A nursing student asks the charge nurse why this drug would be used by a client who is not hypertensive. What is an appropriate response by the charge nurse? A. Most people develop hypertension following an MI. B. A beta blocker will prevent orthostatic hypotension. C. This drug will decrease the workload on his heart. D. Beta blockers increase the strength of heart contractions. The correct answer is C. This drug will decrease the workload on his heart. One action of beta blockers is to decrease systemic vascular resistance by dilating arterioles. This is useful for the client with coronary artery disease, and will reduce the risk of another MI or sudden death. 30. A client has gastroesophageal reflux. Which recommendation made by the nurse would be most helpful to the client? A. Avoid liquids unless a thickening agent is used. B. Sit upright for at least 1 hour after eating. C. Maintain a diet of soft foods and cooked vegetables. D. Avoid eating 2 hours before going to sleep. The correct answer is D. Avoid eating 2 hours before going to sleep. Eating before sleeping enhances the regurgitation of stomach contents which have increased acidity into the esophagus. Maintaining an upright posture should be for about 2 hours after eating to allow for the stomach emptying. The options A and C are interventions for clients with swallowing difficulties.